Doctors have read it. What's the stupidest thing you've had a patient come in for? There was a guy who came to the ER because his iPhone app told him his sleep was poor quality. I used to use a sleeping app that constantly told me my sleep was poor. Screw you, app. I slept like a log. Paramedic here. Had someone come into the ER because they were gay. You should have shot him with the "it's okay to be gay" ray gun, and told him to be on his way. Whilst working as a GP, primary care physician, I had a 40-ish-year-old man come in with his wife complaining of electric shocks for the past year. It quickly became apparent these were static shocks caused by his cheap work suit and rubber-soled work shoes. I explained he just needed to change his shoes, and it would stop, but both him and his wife were baffled. They'd never heard of static shocks and couldn't understand why I couldn't treat his condition. Unfortunately, I have no power to change the laws of physics. When my kids were little, my daughter kept coming into my room and telling me that lightning was striking her in bed and it hurt. For the most part, one just thought she was trying to sleep in my bed and dismissed it. This happened over several nights, and I pointed out that it wasn't even raining. Finally, my son started complaining about the same thing, so I went to lay down in bed with my daughter, and all of a sudden these sparks began to fly, and we got quite the shock. It actually hurt. Turns out I bought them each a new comforter, one blue and one pink, and it was some kind of fuzzy polyesterish material that when you moved it against itself created a significant spark. All you had to do was move the comforter, and if it rubbed up against itself, huge shocking spark. Emergency surgeon here. Got called 2 a.m. because a patient demanded to see me because her daughter's farts smelled too bad. Kept a straight face. Mine is similar to this. The chart said the 38 wild point, vitals normal, reported no symptoms aside from being concerned about the smell of her flatulence. The way she actually said it? I farted blood smell. She demanded a doctor's note to give to her employer. I assumed from this that she actually missed work because a fart smelled odd. 45-year-old male seen in the ER reported severe burns from boiling water, all over his body. On exam he had no visible burns, and had reduced his complaint to a small area on his right index finger, again with zero visible damage. He asked me for hydrocodone several times. It was one of the most obvious drug-seeking behaviors I've seen. He didn't even actually throw boiling water all over himself. The hardcore addicts will go to ridiculously destructive extremes to get what they want. It could have just been warm water, but since there was no evidence, I can't say. Pretty lazy attempt. I found out afterwards that he walked into the ED waiting room and told reception, "I need some hydrocodone." That was the first thing he said. Not a doctor, but worked in an ER for several years. There was certainly a bit of cynicism that is probably prevalent in many similar settings. We'd get people bringing their kids in for hangnail or split ends on their hair. No, seriously. The inverse, however, was that sometimes you could not be too cynical, as it could have been a big deal in the end. I remember one time a Haitian family came in and most of the staff would roll their eyes when Haitians came in because their English was typically terrible and they would not be able to convey what was wrong. In most cases it was something like baby has sniffles or constipation, not really emergencies. This particular family brought a teen who claimed his eye hurt. Between the language barrier and the complaint, most people just shrugged and said, "Yeah, okay, whatever." Turns out the kid got a CT scan that showed worms basically eating his brain. I don't remember the outcome, but the doctors guessed it was poorly cooked pork. To be honest, not sure if the kid even lived or not. I was on the other end of this once, although thankfully it was nowhere as serious. My daughter had a rash appear on her legs very suddenly one afternoon. Because it was Saturday, I took her straight to the ER, where a nurse glanced at her ankle, said everything was fine, yelled at me for not giving my daughter paracetamol, then sent me to the out-of-hours GP clinic, albeit begrudgingly and only because it's hospital policy. The doctor there checked my daughter properly and was absolutely astounded. It turned out it was a really rare type of rash that he'd never seen IRL before. And he confirmed that I'd done the right thing by not giving my daughter paracetamol. I was a volunteer first aider for 10 years. I was on duty at a local judo competition. I was on edge as there was always at least one serious spinal injury. So I was walking around the mats, waiting for the call to rush in and help save someone, and this woman starts screaming and crying. I ran over, as fast as I could. jumping over rows of chairs and ready to help. She was screaming because her baby's first tooth had come through and she didn't know what to do. She asked me to cut out the rest of the teeth so that she didn't have to deal with teething anymore. Nope. Should that person be procreating? No, sleep and hormones make even the best of us crazy sometimes. Was she seriously expecting you to jab a knife into her baby's mouth and peel back its gums? Yep. She expected me to slice open the gums and massage the teeth down into place. My mom took me to the ER once because she thought I had blood poisoning, which is a totally serious condition. What I actually had was fruit punch earlier in the day, and it dripped down my leg. The nurse wiped it off, and I was saved. I'm not a doctor, but I religiously go and see my doctor every summer about a mole I have on my back that could have been cancerous when I was younger due to overexposure to the sun, which caused it to grow and go black. I go every summer because I'm not allowed to have it exposed to the sun, yet they will not remove it. If it was so benign, why am I not allowed to tan my body? Worst excuse I got off a dermatologist was, if we laser that off, you could have a scar going through your back tattoo. I'd sooner have a scar through a tattoo than melanoma, you fucking idiot. Solution: go to a plastic surgeon. They will happily remove that thing. It'll look like it never even happened, and they must submit it for cancer testing. I live in Northern Ireland, and I do not have the money to go to a private hospital for the surgery that I know for a fact that people have gotten moles removed on request in the past. UK here, dermatologist said that my mole that has gotten darker over the years is probably fine, but that they want to take it out just in case. They cut out a 15mm circle of skin, took about 30 minutes, and was free. I work in a burn unit. Had another hospital fly. Yes, fly as in $50,000 helicopter ride a patient over. Patient ended up having what looked like a bad tan on a small portion of their body. There were a couple little blisters on their leg, and they wouldn't stop screaming for pain medication and claiming that they were in 12-10 pain. Fairly sure that sending ER was just trying to dump them on us. Not a human experience, but we had a pup that was about 7 months old admitted for essentially an evisceration. Now, while the thought of a small puppy having a giant hole in its stomach and all of the organs spilling out is terrifying, it was completely preventable. After the spay, the owners were instructed to leave the cone of shame on the puppy at all times if she was not being directly supervised. Well, they didn't, claiming that it looked like it was hurting her, so they took it off and left the house. The puppy promptly licked open her stitches, and from there, it got kind of gruesome. The even more stupid part is that the owners threatened to sue us because it was our fault that they ignored medical instructions, and thusly had to come back in and pay over $1,000 to have their puppy's life saved. People are dumb. Okay, my brother is the doctor. But this story is unreal. He had a guy come in several times with a urinary tract infection. A dude. So that's weird. The first couple of times they were like, okay, that's strange, here's some medicine. Dude kept coming back. Like 6 times with a UTI. They ask him everything they legally can, like why the fuck does a guy keep getting these? Trying to narrow the cause down. Finally they ask him what he does for a living because nothing he answered was out of the ordinary. Brace yourselves. Guy works at high-end gay club where each night he attaches his Johnson to a catheter and serves wine from it. My brother isn't a judgmental guy at all and said the guy seemed to do quite well for himself, but he was like, at what cost? So yeah? I don't even know what to do with this information. I have so many questions. There was this young kid who was crying and told me his cousin might just be pregnant. The kid admitted that they had too much soda to drink, and one thing led to another, and they eventually made eye contact for a full 10 seconds. The kid thought that this impregnated his cousin. I assured him that 10 seconds is not long enough to impregnate someone. As he left the hospital, I realized that the whole thing was so stupid as I remembered that his cousin was also a boy. The stupidest thing I've been to the doctor for. I took my young son in because he had a very regular rash on his lower back. It wasn't until I was in the doctor's office that I noticed that it had exactly the same pattern as the inlet cover on our jacuzzi, which he had just been bathing in. I'm an EMT and one of my patients went to the ER because they felt they had too much earwax in their ears and needed it removed. This actually happened to me. I thought that punctured something with a Q-tip in there before I drove myself in, since I could only hear about 25% the volume in that ear as my other ear. Turns out I just impacted the earwax and they flushed it out there in the urgent care. Do you have a similar story? Leave a comment and subscribe to the channel if you want to see more videos like this one.